If you're over 60, there's something in your kitchen you've always believed was healthy, but it might be quietly putting you at risk every single night. It's a vegetable, yes, just a simple vegetable that you may be eating without suspecting it's silently preparing your body for a stroke while you sleep. There's no pain, no warning. You go to bed feeling fine and wake up unable to move an arm, slurring your speech, or not remembering your partner's name. I've seen this time and time again in my neurology practice. Seniors who do everything right, take their medications, eat their vegetables, and still end up in the emergency room due to a small mistake no one ever warned them about. What if the issue isn't what you eat, but when you eat it and how it interacts with your age, your blood pressure, and your medications? In this video, I'll reveal the 9 most common vegetables that can disrupt blood flow to your brain, increase clot formation, or even trigger bleeding if you don't consume them wisely. This isn't about fear or banning natural foods. It's about understanding how your body changes after 65. Your blood vessels become more fragile. Your kidneys don't flush out fluids the same way. Your blood pressure can shift silently. Your response to sugar and hydration shifts, and what used to be harmless may now have unexpected consequences. You'll hear real stories from my patients like Mr. Ricardo, who only wanted to strengthen his bones, or Ms. Clara, who swore by her daily broccoli, and how their healthy habits nearly cost them everything. It's not that healthy foods are bad, it's that with age, even the good things need new rules. If you or someone you love is over 60, this video is for you. Stick around until the end, because I'll tell you which foods can truly protect your brain, how to maintain your independence, and which simple shifts could mean the difference between a peaceful night or a life-altering scare. And if you haven't subscribed to the channel yet, do it now. This content might just change or even save your life. That is 1. Spinach, the double-edged green on your plate. For decades, we've been told that spinach is one of the healthiest foods you can eat. Rich in iron, magnesium, and fiber, it's a superstar in salads, green smoothies, and meal plans for older adults. But what few people mention is that after age 65, this leafy green can become a silent threat. Let me tell you the story of Mr. Ricardo Morales, a retired firefighter, 76 years old, from Zaragoza. He was always health conscious. Every night, without fail, he made himself a fresh spinach salad with feta cheese and a slice of whole wheat toast. He also took calcium and vitamin D supplements to keep his bones strong. He was convinced he was doing everything right. But one winter morning, his wife found him holding a spilled cup of coffee, staring blankly and slurring his words. What seemed like a minor stumble turned out to be a silent stroke. Tests showed dangerously high calcium levels in his blood, elevated oxalates, and hardened cerebral arteries. The trigger? His evening salad. Spinach is rich in oxalates, natural compounds that bind with calcium in the body. In younger people, these are easily excreted, but in older adults, especially those taking supplements or with reduced kidney function, oxalates can build up. This buildup forms calcium oxalate crystals in the blood, stiffening the small arteries that feed the brain. Over time, this creates the perfect storm for clot formation, and it only takes a tiny clot shifting a few millimeters to block a vessel and trigger a stroke. For Mr. Ricardo, the very salad he thought was his shield became his greatest vulnerability. The most heartbreaking part was hearing him say through tears, "Doctor, I was just trying to do the right thing. I had no idea my salad could hurt me. No one ever told me." This story is more common than you might think. Well-meaning people trying to take care of themselves, unaware of how certain foods can affect an aging body. It's not their fault. It's a lack of clear, age-specific information. So here's what I want you to remember. Even healthy foods can become harmful if they aren't adjusted to your age, your medications, and your current health. If you take calcium, vitamin D, or have kidney or cardiovascular issues, limit your spinach intake at night. It's best to eat it in the morning and never combine it with supplements without medical guidance. And please, don't assume more vegetables always mean better health. After 65, healthy requires context, balance, and most of all, awareness. Eating smart isn't about eating less. It's about eating with intention. 2. Broccoli great for the heart, but not for everyone. Since childhood, we've been told broccoli is one of the healthiest foods you can eat. Packed with fiber, antioxidants, and vitamins, it's a staple in heart-friendly diets, anti-inflammatory meal plans, and health routines aimed at preventing disease. But there's an uncomfortable truth that almost no one tells older adults. Broccoli can pose a hidden danger when combined with certain medications. Let me introduce you to Clara Navarro, a retired elementary school teacher, 82 years old, from Valencia. Clara was disciplined, meticulous, and deeply committed to her health. She followed her treatments to the letter, took daily walks, and each night she'd steam a plate of broccoli with olive oil and lemon. She proudly said, "It keeps my heart young." What Clara didn't know was that this seemingly innocent habit was silently interfering with her anticoagulant therapy. She was taking warfarin to prevent blood clots, a medication that requires stable levels of vitamin K in the body, and broccoli is one of the vegetables richest in vitamin K. Vitamin K plays a key role in blood clotting. But for seniors on blood thinners, sudden increases or fluctuations in vitamin K intake can disrupt the balance. Your blood can become too thin or too thick without any noticeable symptoms until it's too late. One afternoon, after a mild headache and a brief episode of confusion, Clara collapsed. She was rushed to the hospital, the diagnosis a hemorrhagic stroke, bleeding in the brain. Not from a fall or trauma, but because her blood had become too thin to clot. Her INR, the measurement of blood clotting, was dangerously unstable. When her daughter mentioned Clara's nightly broccoli, everything made sense. Not because broccoli is bad, but because even healthy foods can interfere with medication if not consumed consistently and with medical supervision. Clara survived, but her recovery was slow. She now uses a walker and speaks more slowly. Since then, she shares one powerful message with fellow seniors: not everything healthy is safe for us. And she's absolutely right. Eating healthy after 65 is not the same as doing so at 30. Your body changes, your medications affect key systems, and foods that once helped you may now compromise your vascular stability. If you're taking blood thinners like warfarin, clopidogrel, or even aspirin, you don't have to eliminate broccoli, but you do need to consume it in consistent portions and never make big changes without speaking to your doctor. Small variations can have serious consequences. Remember, blood vessels become more fragile with age. A bleed that a young person could recover from might mean memory loss, speech issues, or loss of independence for a senior. Eating healthy isn't just about choosing the right foods, it's about knowing how they interact with your body today, not 30 years ago. 3. Romaine lettuce. Low calorie, but risky at night. Most older adults have heard that eating a salad for dinner is a healthy choice. Light, low in calories, easy to digest, and often there's one main star on that plate: romaine lettuce. But there's a part of the story that almost no one talks about, and it could be the difference between a peaceful night and a stroke by morning. Let me share the case of Mr. Leon Garcia, a 75-year-old retired construction worker from Seville. Leon was active, walked every day, took his blood pressure meds, and avoided heavy meals. Every night, he made himself a big salad with romaine lettuce, cucumber, and vinegar. On the surface, he seemed to live an ideal, health-conscious life. One morning, his wife found him confused, struggling to speak, and with weakness in his right arm. At the emergency room, the diagnosis was clear: a mild stroke while he slept. But the lab results revealed something even more alarming. He was dehydrated. His blood was thicker than normal and showed signs of clotting irregularities. Romaine lettuce, although it seems harmless, is a natural diuretic. It gently stimulates the body to eliminate water. In healthy young people, this has little effect. But in older adults, especially those on blood pressure meds or diuretics, this fluid loss can be enough to cause overnight dehydration. The result: thicker blood, stiffer blood vessels, and the perfect environment for microclots to form. If one of those clots reaches the brain while you sleep, the consequences when you wake up can be life-changing. What made this story even more painful was that Leon thought he was doing everything right. "I only ate salads for dinner," he said quietly from his hospital bed. "I didn't know it could harm me." And he's not alone. Many older adults combine nightly salads with blood pressure medications and low-sodium diets. Altogether, these factors reduce fluid retention and increase the risk of nighttime dehydration. But no one clearly explains that risk to them. To make matters worse, the sensation of thirst weakens with age. Many seniors don't feel thirsty even when their bodies are already dehydrated. And if they go to bed already in a fluid deficit, the effects can be more severe than they realize. The brain, which relies on a steady flow of properly hydrated blood, is often the first to suffer. If you're over 65, avoid eating large portions of romaine lettuce at night without proper hydration. Consider shifting your salad to lunchtime, when your body can better handle its effects. And never underestimate the power of a glass of water before bed. Eating healthy isn't just about what you eat, it's about when and how you eat it. 4. Raw carrots. A hidden spike for your brain. Raw carrots seem like one of the safest snacks in the world. Sweet, crunchy, low in calories, packed with beta-carotene, and great for your vision. For many older adults, they're the perfect snack, natural, easy to chew, and far from processed junk. But what almost no one warns you about is that if eaten in excess and at the wrong time, they can be far more dangerous than they seem. Meet Laia Menendez, a 78-year-old retired nurse from Bilbao. Laia was sharp, active, and convinced her eating habits were exemplary. She had cut out processed sweets and replaced them with raw vegetables, especially carrots. "They're my favorite bedtime snack," she said proudly. But soon, symptoms began. She woke up dizzy, with tingling in her hands and a strange feeling of confusion. She blamed it on aging, until one morning she couldn't remember how to make coffee, a routine she had repeated every day for 40 years. At the hospital, she was diagnosed with a minor stroke. The cause? Blood sugar fluctuations during the night, triggered by eating raw carrots just before bed. While carrots have a relatively low glycemic index, raw carrots still contain rapidly absorbed carbohydrates. In younger adults, this isn't a big problem, but in seniors with prediabetes or insulin sensitivity, it can create a spike in blood sugar followed by a sharp drop during the night. This nocturnal hypoglycemia triggers the body's emergency response, releasing cortisol and adrenaline, raising blood pressure and narrowing blood vessels. The result? Thicker blood, unstable pressure, and a higher risk of clots in the brain's fragile vessels. Laia was caught in an internal storm caused by what she thought was the healthiest snack in the world. During her recovery, she looked at me in disbelief and said, "I never imagined carrots could do this to me. I just wanted to take care of my health." And that's the most common mistake, thinking that if a food is natural and plant-based, it's automatically safe at any time of day and for anyone. But that's not true. Even healthy foods can have unexpected effects if we don't consider our age, metabolism, and medical condition. If you're over 65 and often snack on raw carrots at night, stop doing it immediately. You don't have to cut them out entirely, just use them wisely. Eat them during the day, ideally paired with a source of fat or protein like hummus or a boiled egg. This slows the sugar impact and protects your brain. And above all, don't ignore warning signs like dizziness, morning confusion, or unexplained fatigue. They could be linked to your nighttime blood sugar. Brain health doesn't just depend on major life choices. Sometimes it's in a small nighttime habit that seemed harmless. Changing it could mean the difference between living fully or living with limits caused by an avoidable mistake. 5. Garlic, a natural blood thinner with hidden dangers. Garlic has been praised for centuries as one of the most healing and powerful foods in existence. It's credited with lowering blood pressure, reducing cholesterol, improving circulation, and even preventing infections. Many older adults consume it daily, whether fresh, in capsules, or as part of a healthy diet. But behind its medicinal fame lies a risk that very few people know about. Its blood-thinning effect can be devastating if not managed carefully. Let me tell you about Tomas Rivera, an 81-year-old retired railway machinist from Zaragoza. After a minor heart procedure, his doctor prescribed a blood thinner to prevent clots. Like many people, Tomas also believed in natural remedies. He had read about the benefits of garlic and decided to take a daily 600 milligram concentrated garlic extract supplement, plus one raw clove each night with dinner. "I do it for my heart," he said confidently. But just a few weeks later, he began suffering severe headaches, nausea, sensitivity to light, and difficulty speaking. He was rushed to the hospital. The diagnosis was clear: a hemorrhagic stroke. His blood was so thin it couldn't clot, and the cause wasn't just the prescription medication, it was the combination with garlic. Garlic is a potent natural anticoagulant. It inhibits platelet aggregation, meaning it prevents the blood from thickening and forming clots. While this can be beneficial in some situations, if you're already taking blood-thinning medications like warfarin, clopidogrel, rivaroxaban, or even aspirin, garlic's effect adds to the drug's effect. That can tip the balance toward uncontrolled bleeding. In Tomas's case, his CT scan revealed a small blood vessel rupture that under normal conditions the body could have sealed, but his blood was so thin the vessel couldn't hold. He spent weeks in therapy and lost part of his short-term memory. He also developed anxiety afterward, fearing he might unknowingly make the same mistake again. He told me with sadness, "I just wanted to take care of myself. I didn't know garlic could do this to me," and that's the problem. Most people don't think of garlic as something that could interact with their medications. They see it as food, not as an active chemical agent. But in reality, garlic, especially in concentrated supplement form, should be treated like medicine with its benefits and its risks. If you're over 65 and taking blood thinners, talk to your doctor before consuming garlic regularly, especially in capsule or extract form. Watch for any signs of bleeding, unexplained bruising, dizziness, frequent headaches, or blurred vision. Even moderate doses can have cumulative effects when combined with certain drugs. Remember, natural doesn't always mean safe. Your body changes with age, and what once helped you could now harm you. The key isn't living in fear, it's living with awareness and responsibility. 6. Onion: a drop in blood pressure, a rise in risk. Onion is one of the most common and beloved foods in the kitchen. It's found in sauces, stews, salads, and soups. Many consider it a superfood for its anti-inflammatory, antioxidant, and cholesterol-lowering properties. But what almost no one mentions is that in older adults taking blood pressure medication, onion can cause a silent and dangerous drop in blood pressure. Let me tell you about Jorge Lamas, an 80-year-old former soccer coach from Cadiz. He had always been an advocate for natural remedies. After his doctor prescribed a beta blocker for his blood pressure, he decided to boost the effect by eating raw onion every night. "It's good for the heart," he'd say. His dinner always included a generous salad with onion, vinegar, and olive oil. At first he felt light and energized, but soon morning dizziness set in, along with vertigo when standing up. One night as he got out of bed, he fainted and hit his head on the table. The next day, he couldn't remember what day it was or where he had left his keys. At the hospital, after several tests, the diagnosis was alarming: a minor ischemic stroke caused by a sudden drop in blood pressure during sleep, which triggered an uncontrolled vascular response. Onion contains quercetin, a powerful antioxidant that acts as a natural vasodilator. This means it helps open blood vessels, lowering pressure. Sounds ideal, right? But if you're already taking medications that do the same, like beta blockers, ACE inhibitors, or diuretics, the effect can double. The result: blood pressure that's too low, especially at night when your body is most relaxed. When blood pressure drops too much during sleep, the brain gets less oxygen. The body reacts by constricting blood vessels to protect itself, but this rebound effect can form clots, especially in aging arteries. Those clots can cause a silent stroke without you even realizing it until it's too late. Jorge recovered, but he no longer drives and needs help with activities he once did alone. He told me in frustration during a follow-up visit, "I just wanted to take care of my heart. I never thought something as common as onion could hurt me." Many older adults believe that if something is natural, it's harmless, but that's not the case. As you age, your blood vessels become more sensitive, and the interaction between foods and medications becomes critical. What was once safe may now be risky. If you take blood pressure medication, avoid eating large amounts of raw onion at night. You can still enjoy it, but in moderate portions, preferably cooked and during the day. And always let your doctor know if you're making dietary changes, even if they seem healthy. Remember, protecting your health isn't just about what you eat. It's about how, when, and with what you combine it. Even a simple onion, if misunderstood, can be the spark that ignites a fire in your vascular system. 7. Corn, sweet and golden, but silently dangerous. Corn in all its forms brings back memories of home, family gatherings, and traditional dishes. Whether as boiled corn on the cob, cornmeal, or in soups, this sweet grain has been an essential part of many kitchens for generations. For many older adults, it's a comforting, seemingly harmless food. But what few people realize is that as you age, corn can trigger dangerous metabolic reactions if eaten the wrong way. Let me tell you about Dolores Alvarez, a 77-year-old retired librarian from Valencia. She lived a calm, orderly life. Every morning she had cornmeal porridge with honey, and at night she enjoyed a boiled corn on the cob. It was her ritual, a way to return to the flavors of her childhood. But she began noticing she felt increasingly tired upon waking. She experienced dizziness when standing, trouble concentrating, and even mild confusion. Her blood pressure fluctuated, normal one day, spiking the next. Then one morning, her husband found her motionless, unable to move the left side of her body. She had suffered a mild ischemic stroke during the night. Medical tests revealed elevated fasting glucose, thick blood, and signs of microvascular brain damage. The trigger? Regular consumption of high glycemic corn, especially at night. Though often considered a vegetable, corn acts like a starch. Its natural sweetness translates into sugars that quickly raise blood glucose levels. In younger people, the body manages this easily, but in older adults, especially those with insulin resistance, poor circulation, or on blood pressure medication, these glucose spikes and drops can turn into a metabolic roller coaster. At night, the body doesn't need large amounts of energy. If you eat corn, then glucose spikes quickly. The body responds by releasing insulin, but often too slowly or too aggressively. The result is a sudden drop in blood sugar during the night. This nighttime hypoglycemia triggers stress hormones like cortisol and adrenaline, which raise blood pressure and thicken the blood. And that's the perfect environment for microclots to form and travel to the brain. Dolores recovered with rehabilitation, but her mobility remained impaired. She told me through tears, "I ate like my mother. I never imagined something so familiar could hurt me." And she's not alone. This pattern repeats itself in many older adults. It's not about cutting corn out completely. It's about understanding how it affects an aging body. If you're in a high-risk group, diabetic, hypertensive, or with circulatory problems, avoid eating corn alone and at night. Pair it with protein or healthy fats, and keep close track of your glucose. Nostalgia shouldn't cost you your health. What was once safe can become a hidden risk if it isn't adapted to your age, your medications, and your current needs. 8. Asparagus soft on the outside, draining on the inside. At first glance, asparagus seems like one of the healthiest vegetables in the world. Elegant, low in calories, rich in fiber, potassium, and antioxidants. It's recommended in heart-healthy diets, detox plans, and weight loss regimens. Many older adults add it enthusiastically to their meals, especially dinner. But here's something almost no one tells you. Asparagus can dehydrate you while you sleep, creating the perfect setup for a silent stroke. Let me introduce you to Juana Ramirez, a 79-year-old retired school counselor from Zaragoza. She had always been active and disciplined. She walked every day, avoided red meat, and cooked everything from scratch. Her favorite dinner? Steamed asparagus with lemon and a touch of olive oil. "I feel light and clean when I go to bed," she would say. But one morning, she didn't wake up the same. She was confused, couldn't remember her address, or even her granddaughter's name. At the emergency room, tests revealed a minor ischemic stroke. Her blood work showed elevated hematocrit, thick blood, and signs of nighttime dehydration. Juana avoided drinking water in the evening to keep from getting up at night, and her asparagus, healthy as it seemed, was draining even more fluid from her body as she slept. Asparagus is a natural diuretic. It gently stimulates the body to eliminate water and electrolytes. In younger people, this has little noticeable effect. But in older adults whose kidneys work less efficiently and who may already be taking diuretics or blood pressure medication, this extra fluid loss can cause the blood to thicken during the night. Thick blood plus fragile vessels is a dangerous combination. And with age, the body's thirst mechanism becomes less sensitive. Many seniors don't feel thirsty even when they need water. Add a fluid-draining food to that, plus a medication that does the same, and you've got the perfect environment for brain clots to form. After her recovery, Juana told me, "I never imagined something so green and pretty could dry me out from the inside. Her case is more common than you'd think. I've seen many patients with similar habits, convinced that a light dinner is always safe without realizing how it affects their hydration and circulation. If you're over 65 and often eat asparagus at night, be sure to pair it with plenty of water and avoid combining it with other diuretic foods or medications. Better yet, move it to lunch when your body is more active and can better compensate for the fluid loss. Brain health depends on a steady, balanced blood flow. Even mild nighttime dehydration can disrupt that balance. What you eat at dinner might seem light, but if it changes your blood volume while you sleep, it could wake up serious consequences. Choosing healthy foods isn't enough. You also have to choose the right timing. And after 65, that can make the difference between a normal day and a life limited by an unexpected event. 9. Tomato, a stroke imitator hiding in your kitchen. Tomato is a symbol of health, fresh, juicy, versatile. We use it in salads, soups, sauces, and juices. Rich in lycopene, vitamin C, and antioxidants, it's considered a natural protector of the heart and skin. But what many don't know is that in older adults, tomato can trigger a chemical storm in the brain that mimics a stroke without actually being one. Let me introduce you to Gertrudis Herrera, an 83-year-old retired piano teacher from Seville. Proud of her memory, vitality, and love for natural remedies, she drank homemade tomato soup with garlic and herbs every night as part of her evening ritual. She firmly believed this habit kept her young. Until one morning she woke up confused with blurred vision and a severe headache. She couldn't form complete sentences. Her daughter thought she was having a stroke. At the emergency room, however, the test showed something different. No clot, no hemorrhage, but there was inflammation, cerebral vasospasms, and electrolyte imbalance. The cause, a reaction to active compounds in tomato. Tomato contains histamines, pteramines, and solanine, substances that go unnoticed in young people but can cause side effects in older adults. Histamines increase inflammation, pteramines can raise blood pressure, and solanine, even in small amounts, can affect the nervous system. Combine that with an aging body, fragile vessels, and low tolerance to chemical imbalances, and the result can be devastating. What's most concerning is that these episodes mimic a stroke: dizziness, slurred speech, numbness, double vision, but without structural brain damage. They're called stroke mimics, and they can lead to anxiety, misdiagnosis, or unnecessary treatments. In Gertrudis's case, her tomato soup, combined with a low-sodium diet and a night without enough hydration, was the perfect storm. She told me with a trembling voice, "I never thought a soup could play with my mind." And her story is not unique. Many older adults don't realize that tomato, especially in concentrated form like sauces or juices, can irritate the nervous system, especially if consumed in excess or at night. It can also interfere with certain blood pressure or neurological medications, altering their effectiveness. If you're over 65 and eat tomato regularly, have it at lunchtime when your metabolism is more active. Avoid tomato soups or juices at night, especially if you're on medication or have a history of high blood pressure, anxiety, or migraines. Brain health isn't just about avoiding harmful foods. It also means recognizing that even healthy ones can have a double edge, depending on the timing, amount, and your current health. Tomato isn't the enemy, but if you don't know its hidden effects, you might mistake a serious warning sign without realizing it came from your plate. After learning about these 9 vegetables and their hidden effects, it's normal to feel confused, even worried. You might be thinking, So now I can't eat anything or what's actually safe now. But you're not alone. As a neurologist who has cared for hundreds of older adults, I want to leave you with a clear message. This is not about fear. It's about awareness. Your body at 65, 70, or 80 is not the same as it was at 40. And that's okay. You've walked a long path, gained wisdom, experience, and along with that, your body has undergone physiological changes. Your blood vessels are more fragile. Your ability to stay hydrated, regulate blood sugar, and metabolize food is different. What was once harmless may now require new rules. The stories you heard here from Ricardo, Clara, Leon, Laia, Tomas, Jorge, Dolores, Juana, and Gertrudis are not dramatic tales. They are real people. People who wanted to do the right thing, but didn't have the right information for their stage of life. People like you, or someone you love. The big mistake wasn't eating spinach or having carrots for dinner. The mistake was not knowing when, how, and with what to combine those foods. Because the key to brain health is not in eliminating, but in adapting. Adapting your habits to your current reality, and that's exactly what you can start doing today. So what can you do from now on? Eat your vegetables during the day, not at night. Avoid risky combinations without consulting your doctor. Stay properly hydrated, especially if you take medications that affect blood pressure or fluids. Watch for your body's signals: dizziness, confusion, blurred vision, morning fatigue. Don't ignore them. Keep a food journal and note how you feel afterward. That small effort can help you spot patterns before they turn into serious problems. And above all, don't feel guilty if you are unknowingly doing something wrong. Guilt doesn't heal, but awareness does. Starting today, you can make safer, more informed decisions aligned with your current well-being. Longevity isn't just about living more years, it's about living them well with mental clarity, mobility, independence, and energy. And that starts with small but conscious decisions, like moving a salad to lunchtime or avoiding tomato juice at night. Thank you for staying with me until the end. If this video helped you better understand how to protect your brain, leave a comment with the word awareness. And if you know someone over 60 who could benefit from this information, share it with them. It might just change their life. Don't forget to subscribe to the channel and give it a like. We'll keep sharing medical knowledge adapted to your reality, because your health is not about general rules. It's about you.